viewers. Today we have two legends with us, Dr. Sunita Tandulwadkar, Fogsi President, and Dr. Krishnendu Gupta. When I will read his CV, then you will come to know what a legendary person he is. So first of all, let me introduce Dr. Sunita.
No
She
introduction
is,
of mine.
nahi
Please.
ma'am,
No.
just in two lines, okay? She is not merely a name in women's health, it is a movement shaped by courage, compassion, and extraordinary sense of inclusion. A visionary obstetrician and gynecologist, she blends scientific brilliance with a rare human warmth. She is a very spiritual person, and I have worked and learned so many things from her. I was just saying to sir that I just cannot stop what madam's dedication is. It is really brilliant, and we are learning how to work and how to go about everything. The confidence you have, and the inclusion, and the space, and so many opportunities which you have given to the committee chairpersons, which were never given earlier, ma'am.
You
So
don't know
now,
about earlier. Don't say anything. Thank you so much, Poonam. Thank you for your kind word. If I listen to these words many more times, which I join at 8 p.m. every day, एक दिन मुझे ना I will get inflated with big egos. Let me be humble, let me be grounded. So I don't want too many words, but I appreciate your word of
thank
appreciation.
you.
And thank you so much. But Krishnandu, welcome on a Foxy platform. You are a Foxy and you are the past chairperson of ICOG. And it's like घर में आए हुए बंदे को ही घर में आओ. But you are a hardcore Foxy organization man of ours. But coming on the Star Pravaha platform is a different honor, different dedication, different feeling. And I join every day 8 p.m. just to showcase our respect to the faculty, that it is the Foxy entire organization is grateful to you for taking out time and giving Poonam a beautiful podcast. Poonam is one of my most sincere, dedicated, but most importantly, what you need is a dependable. Krishnandu, I'm blessed. Out of 30, my 25 chairpersons at least are mind blowing. रात को फोन करो, अभी कल सुबह तुझे ये मीटिंग को जाना है ये प्लेस पे, they don't say no. They said okay man. फोन करके बताती हूँ एक रात में तुम्हें ये आर्टिकल लिख के देना है मुझे. By 8 a.m. tomorrow, you should be mailing me. The article will be on my table. So amazing work. What they needed is some guidance to them so that they can excel their performance. And in podcast, you will realize the depth of knowledge. These are our future leaders of Foxy. And I'm sure these leadership qualities they have developed, they have it in their own, and they have shaped it beautifully. Thank you, Poonam. Thank you for having
ma'am. Thank you.
Thank you so much.
Thank
I really
you.
appreciate your time and I appreciate your inspiration. I appreciate your, what shall I say, your enthusiasm, and there's no adjectives left actually. I mean,
You know, everyone told me when
I know you for a very long time, so I know what I'm saying.
Gyan Pravah, Sunita, this is impossible, crazy. I still remember Reshma Pai telling me, not only when she heard, but from time to time, are you insane, Sunita? Do you think it is possible to any human being? I said, देखो, Foxy presidency ली है, तो impossible को possible करना है. I have very committed committee chairperson, and giving them 1 hour platform to take an interview, to take a podcast and choose the faculty of their own, that will give them really a very big boost. And 325 today, I 24, 23.
24th today.
Yeah. So imagine 324 days over. 10 January is my last podcast.
But I have a request, Sunita.
Yes.
The secret of your energy, the nutrition that you're taking, you must write a little chapter on it.
I'm giving in
keep you
Calcutta
going.
the oration of the same.
No.
You won't imagine. Yesterday there was a ISAR site meeting in Ahmedabad. My flight to Pune got cancelled with political influence. I got a flight to Mumbai. Mumbai, Pune, it took me 8 hours to come, complete
God.
traffic block.
What?
I reached at 4 a.m. and I started my day at 9 a.m. with robotic hysterectomy. And
Wow.
9 a.m. actually it was 6 a.m. but I was not getting any flights. So first thing I told Ruby Hall is please reshuffle with the other surgeon. I was supposed to do 5:30 to 8, give other surgeon and give me 9 to 11 because the first morning flight was reaching to Pune at 6:55. I said,
God.
it is crazy, and I'm continuously working with that. But
Outstanding.
our passion, every one of us here, I'm not an exception. Every one of us work midnight flight से गए अहमदाबाद 3 a.m. के फ्लाइट से गए. Today night I'll
सर
catch.
मैं कहती हूँ कि मैडम हमारे फॉक्सी के सचिन तेंदुलकर हैं.
No,
मेरे को
no.
हमेशा ऐसा लगता
I
है.
take my IV therapies, I take my stem cell. Probably that gives me more. And of course, the nature of your work. Thank you.
Absolutely.
Today's the postcards is for Krishnendu. So I joined the viewer league and you both have
Thank you
it.
so
Thank you
much for
so
the
much.
opportunity. Thank you for
Thank
the
you, ma'am.
opportunity, Sunita. Thank you.
Thank you.
Thank you.
Thank you, ma'am. Thank you so much. So now it is the time to introduce Sir Dr. Krishnendu Gupta, a luminary in obstetrics and gynecology, global academic leader, and a very good human being. He is an iconic name in obs and gynae and admired for his academic brilliance, visionary leadership, and lifelong commitment to women's health. His distinguished career seamlessly blends with clinical excellence, scholarly depth, then global advocacy. He is an alumnus of Mangalore and Manipal. Professor Gupta holds an exceptional portfolio of national and international credentials. He is FIC, MCH, FICOG, FRCPI, that is from Ireland, then FRCOG, London, then FACOG, that is honorary USA. Then this reflects his worldwide recognition by the premier professional bodies. Since 2002, he has served with distinction as professor and union head in Department of OBG, Vivekananda Institute of Medical Sciences, Kolkata, while also contributing as adjunct professor at Kasturba Gandhi Medical College, Manipal, nurturing generations of clinicians and academicians. So he is mentoring many and he has mentored many. So his illustrious journey is marked by prestigious accolades, including the ACOG Honorary Fellowship, which is, I would say, a very rare thing you will see in our group of Foxians. Very few people have this regard. So, and he is a very dedicated person and very, working for Rotary Club, and he is district governor for Rotary Club. And under him was 11 districts, and he has worked a lot of in that for the health of the woman. And currently he serves as Deputy Secretary General of AOFOG, and he is FIGO Climate Chair and Toxic Environment Exposure Committee and co-chair of CEFOG Women's Sexual and Reproductive Rights Committee. He is shaping policies at intersection of health, environment, and human rights. A respected academic voice, he has served as national corresponding editor for Jogi, editorial board member of JCEFOG, and peer reviewer of leading journals. As an international lead fellow and examiner for MRCPI Part 1 and Part 2, and he continues to influence global postgraduate standards, and his Rotary journey is almost of 30 years, a man of refined sensibilities, and he is also a trained pianist, reflecting a rare harmony, intelligence blended with science and art. Like his name on Krishna, the symbol of wisdom, balance, and purposeful action, Professor Krishnendu Gupta leads with clarity of thought, compassion of heart, and an enduring commitment of dharma in women's health. So our today's topic of discussion, which I chose only because my guest has this state That is why I chose this topic. The topic is that the unseen curriculum, the wisdom we learn, but we never teach. So these are the things which we learn when we work with our seniors, with our mentors, and we really imbibe those things and they shape our life in future. So, sir, what would you say when the term unseen curriculum comes? What it personally means to you?
Well, at the outset, thank you very much, Poonam, for that very, very, what shall I say, humbling introduction. And also many thanks to our Fogsi president, Dr. Sunita Tandulwadkar, for giving me this opportunity. But for me, basically, the unseen curriculum is, it encompasses everything that shapes us, not only as doctors, but as individuals, but never appears in our daily lives, in our official timetable, as we want it, or syllabus. It is what we learn when we are in the hospital, in the corridors, in the wards, in the labor room, in various audit or mortality meetings or morbidity meetings. And we learn, more than what we learn from our lectures and textbooks. So, it just starts from the way we, see our seniors, or we learn how to take care of, breaking bad news to a grieving family, or how we decide, despite our duty hours being over, when we should stay back and not look at ourselves, putting the patient first, and then manage our fears, when we are treating patients, when we see a patient crashing. So these are some of these, the quiet understandings, which I personally feel encompasses the unseen curriculum, the responsibilities that we share for a human life, which I guess no examination can actually teach you.
So I think these are the most crucial lessons which we learn. They are not learned from the textbooks.
Yeah.
You will agree with that, huh?
Absolutely.
Mm-hmm. So what is the most important wisdom that medical training silently passes to its trainees? Silently it goes to the trainees.
I think, there's a beautiful phrase that you will never have complete control, but you must take complete responsibility. So we have to be totally responsible for our patient's life, for our patient's well-being. And we have to be very, very kind of empathetic, and to show that, the right outcomes are there. And it's something that we must always want to learn, keep learning. It's not that I know it all, or, and we have to be accountable. We cannot fix everything, but that, maturity, the responsibility is what actually shapes and what we actually transmit to our juniors, the way we behave with our patients, how polite we are with the nurses. And that's very important, because if you see a senior, kind of misbehaving with a nurse or talking very rudely, which is actually misbehavior, the person feels that, oh, this is a done thing, we can do that. But this is not so. So we have to really ensure that our own behavior are the set standards, standards to which our juniors or the people who we are mentoring, they follow. Along with all this comes your wisdom and your experience and your practice and things like that.
Can you share any moment where you felt that during training, you realized that there is something hidden in this, textbook reading, something hidden in this curriculum?
Well, I'll be, there are so many times we always learn from our seniors, right? We always learn from our teachers. And when I was a postgraduate in Manipal, I still remember we were all in the labor room one day, and one night rather. And there was this patient who came, and, those days I'm talking about in the mid 90s, or, late 80s, not mid 90s, late 80s. And really couldn't find the fetal heart properly. And we found that, the baby was like, we could feel the baby. So we thought, my God, how is it possible? And she was not a very obese patient. And then our head of the department came and just did some, touched and said, this is a secondary abdominal pregnancy. Give me the uterine sound. Uterine sound. We were flabbergasted because we didn't have ultrasound those days. Ultrasound was there, but it's a huge ultrasound in one room far, far away. So, these are
We to never
things
had.
which, so I'm telling you. So I've seen it. I can never forget it. So these are things which, you understand. So nowadays, unfortunately, the tricks of, obstetrics is gone, all that maneuvers, that all these things we do,
Yes.
most of it's forgotten, unfortunately. I mean, we only even as an examiner, even now, the Keelan forceps, I've never applied one, never seen one being applied. But for historical interest, but there are people still in the UK who are applying Keelans. There are some people in India who apply Keelans fantastically. But I guess, these are things which I'm, sharing with you, which stay with you. Stay with you.
You can never forget such moments.
And what teaches you also is the behavior of your seniors, of your teachers. So this is something which is there in the so-called unseen curriculum which we are discussing.
So what happened on that day with that patient?
She was taken up for C-section, and it was lucky. That absolutely was a secondary abdominal, and it was absolutely miraculous.
We see miracles happening, sometimes, and you really don't believe your luck on that day. So how does this unseen curriculum shapes a doctor's professional identity over the years?
It does, because, in critical, I always say in critical situations, you really don't have time to remember what is all there in your textbooks. You learn by your, just by your sheer, what shall I say, experience, what you've seen your seniors to do. So if you are, and most important thing is that you have to be calm. Because if you start getting stressed, tensed up, okay, what am I going to do? Your entire thought process, gets muddled. What is also important is not only quick assessment, clear communication, there has to be shared responsibility. There should not be any chaos, because, we have seen, unfortunately, all of us have seen in our lives, certain seniors, certain teachers who love to create chaos, screaming, shouting. And at that point of time, the juniors get even more scared and more muddled what to do than give you, so they are also scared to say anything. So there has to be this openness. And that is one of the things which is very important, that if a teacher or a senior allows constructive criticism, allows openness, allows discussion, self-introspection, I think that, it's a very, very important environment for juniors to learn. They should be allowed to question why. Certain places you've seen, we are so scared. The environment is such that you cannot ask why. You're scared to even open up. And you must admit to your mistakes. I always feel like that. All of us, we are clinicians, we have made our mistakes. I've got umpteen number of cases which I have handled, which I have made mistakes myself, but never hide your mistakes. Because that's another thing. If you hide as a senior registrar, the juniors think that, oh, acha, so this is done. This is a done thing. This is acceptable. No, you own up. And I'm telling you, if you have a senior or a teacher who's been there, done that, it's like saying, if someone has not perforated the uterus while doing a DNC or a DNE, I think either if the person says, no, I've never done it, either they have done too few or they're lying. Simple. So you have to own up. You have to say, okay, I've done this mistake. How to rectify it? How can I? So this is something which is extremely important in the area of, and you must acknowledge honesty. That's another thing. That if someone acknowledge that I've done it, don't be harsh on that person. So everything boils down to mentorship, boils down to how the teacher, and we've been teachers for a long time now, so we know that we should not be harsh on them, because they are also learning, just like we were. I always, when I take exams, I always feel that what was my state when I was an examinee and not an examiner. Okay. I know how stressed I was. I know how many books I carried to that exam hall. There was even a nurse who joked, a senior nurse told me, what, Dr. Gupta? will you be reading all these books now? I said, no, makes me feel good. So we have to be nice. We as examiners in Manipal, we have this fantastic teaching learning program there, student evaluation program. The medical education department in Manipal was very strong for, 40 years ago. I can never forget Professor Krishna Rao, the husband of the great teacher of teachers, our teacher, Professor Padma Rao, who even taught my professor, Professor Pratap. There is a must-know area, the circle. So when we take exams, there's a must-know. Then there's a nice to know and a very nice to know. You should never start from very nice to know. Because if it's very nice to know, the person may fail. May not be able to answer. After some time, they will not even utter their own name. So start with must know. Must know is your basics. So if a postgraduate, an MS candidate, or those days it was MD, now it's MS. If an MS candidate doesn't answer repeatedly must know areas, then you have to be, then you are feeling good that, okay, I'm not failing this candidate just like that. You have to give opportunities. We never want to fail anybody. Never. So we as examiners, I always use the word malignant. Those malignant examiners are gone now. We are all benign, nice examiners. We want to know what the candidate knows. We do not want to know what the candidate does not know. So this is again in the hidden curriculum for examination, taking exams.
Yes. I never knew like this. You don't know, must know, nice to know.
So must know, nice to know, very nice to know. So you don't ask very, 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 very difficult syndromes right in the beginning.
Right. Got it.
You understand? So this is the way we go about it.
Sorry. Create a positive, environment.
Exactly.
And after, I think, once the candidate starts answering those must-know questions, then they become more confident in...
Exactly. Automatically, their performance improves. They start answering better. And it's a pleasure to take examination for such candidates.
So, have you seen any difference in this kind of curriculum in various different institutions? Because you have seen, I think, many institutions by now.
Well, I mean, you're asking a very, very, frank question, and I'll give you a frank answer. Of course, there are certain institutions you go, you can, the moment you enter, it's a very strict, rigid, strong, okay, this is, it's my way or the highway. It's, it's like that. And there are certain institutions you go, you see, okay, they're chilled out. Okay, fine. Okay. We have an intern. It's also very nice that, I always love it when we go to take exams or we go to teach where you have an internal assessment. Now you see a candidate, we assess a candidate in just what? A long case, half an hour, 40 minutes, 45 minutes, and then short cases for 20 minutes. Sometimes it's not enough. If someone has really worked hard because of certain stressors, they may not do it. But if the internal assessment, the internal takes out the internal assessment and says, okay, Krishnendu has actually got, 22 out of 25 or 22 out of 30 in internal assessment. This candidate is not a bad candidate. Although this Krishnendu would have done not too well in the long case. So these are the things which help you. And whenever I feel there are these constant, as we discussed, the feedback, the introspection, the examinations, the training, you actually feel much more kind of easier to go and, be in those institutions and survive in those institutions, not only as a teacher, but also as a resident, junior resident or a senior resident.
So how does humility influence professional growth? And how do trainees pick up by observing their seniors?
See, humility is, sorry, please go ahead.
No, you.
No, please tell me. No, humility is something, it's a great, thing to have. If you're humble, you will be given adequate opportunities. You cannot be arrogant. The place of arrogance and misbehavior is gone. I mean, just digressing from, because you asked me, why are we having these so-called medical legal issues most of the time? It's because we don't communicate. We are not actually communicating enough. We have to be, doctors are, not all, but a lot of them are very poor listeners. We want to keep blabbering and talking. So we also have to be proactive listeners and listen and then communicate effectively. Because I feel if you communicate effectively and you communicate with empathy and with humility, things are way forward. Because it's like this. Once, this is again a thing which I always wonder, that if the training is such that you don't speak enough, the juniors think that is the way. But actually, you should be, the patient, the relatives, or we say the patient party here in this side of the, in Calcutta, they must be kept informed what's happening. And of course, documentation and things like that are important. But you said the word humility, because I always say knowledge is important.
Yes.
But if you are not a good human being, you cannot become a good doctor.
Yes.
And that is where I guess spirituality, your thought processes is very important. It's very important.
I think you cannot teach humility. You cannot teach it. Huh? It is just by observation.
You are brought up with it. You are brought up with it.
You are brought up. Right. And I think at your family level and at your working place also, if that atmosphere is there, then how does this invisible learning affects the decision making during intense critical situations? Because if you see your senior is doing, that will, affect.
So that's what I'm saying. It's, if you are calm, if you're being trained well, you avoid unnecessary chaos. You don't have that kind of environment where there's a lot of chaos. These are the things which help taking correct decisions in terms of emergency. That was your question, right? So your thought process, because after all, you are trained. All of us have undergone training. So we have that minimal basic training to deal with a patient. But if in that scenario, there's a lot of hullabulla in the, in the surroundings, you cannot think straight. What you would have normally done correctly, you will be hesitant.
Or you may do it wrongly. Okay.
So we try to follow the seniors. We try to see, and we learn from our seniors in every other way possible. Because after all, this is what leadership is all about. Because when I always say, when we equate obeisance with excellence, we produce followers. But what is important is we must make sure that the people who are following you, be nice to them, be humble to them. It should not be my way, or the highway, or my way is the only way, and things like that.
So can these elements of hidden curriculum be harmful to younger doctors? Like if your senior works like that, the weakness has never to be shown in front of patients, something like those things. Are they harmful also to the trainees?
No, you see, weakness is something which should not be shown in a very big way in front of. Because why would a patient come to you? The patient wants a confident doctor. If a patient finds a doctor not confident or not sure of himself or herself, you're not going to have that, patient with you for too long. So, but by sharing knowledge or by sharing something which you may not know, because, whenever a patient comes to you, you may not have all the reports or everything, in front of you to make an absolute perfect diagnosis. So you must be humble enough, and that's not weakness. Again, humility. You must be humble enough to explain to the patient or the relatives that, this is what I know from what I have in front of me, which will change depending on what I get later on. So you may advise more tests or more examinations or things like that. So it's a constant changing process. It's a dynamic process. But by showing that you don't know everything at that point of time is not weakness. But I think that's the correct way forward. And that is what will help you should a patient not go well later on, because you have kept them informed while the things are going. So this is what I feel has been my journey. I've always been very upfront and very frank. But there's another, lopsidedness in, unfortunately, that if you counsel too much, then they think. I'll give you a simple example. Like in a patients who don't understand too much. Let's say you're in a hospital, in a community-based hospital, and you say, okay, I'm going to do a hysterectomy. And okay, everything will go well finally. But then your bladder may get injured, your rectum may get injured, your ureter may get injured. So then they actually sometimes feel that this fellow is definitely telling us all this is because he's going to injure all this. So again, there has to be a kind of a fine balance between showing, counseling and actually telling them, no, these are rare things, but you must know. Like we take, even till date, we always take a kind of consent for hysterectomy when we're doing an open myomectomy, although open myomectomies are becoming rare nowadays because of laparoscopy. But what I'm saying is we used to always do that, right? But that doesn't mean that all our myomectomies end up in hysterectomy.
Yes.
है कि ना? हम तो लेते थे ना? तो ऐसा नहीं कि हम जो भी myomectomy कर रहे हैं वो hysterectomy में end हो रहा है, वैसा तो नहीं हो रहा था.
नहीं.
So it is like that. I mean, things you're asking me, things are coming to my head, and I'm just telling you.
So I think if we do like this, so that will have a negative influence on the patient's thought process.
But you must tell them that what is the incidence of these problems and what is the reality. And of course, and now we have Dr. Google Mama, who's actually created more issues for us.
More issues, yes. So what unspoken lessons help clinicians deal with uncertainty in patients' care?
Can you repeat the question again?
Unspoken lessons help clinicians deal with uncertainty in patients' care.
See, in medicine, as I said, it's dynamic. So there is nothing certainty in it. So, but it is also important to analyze that uncertainty is not failure.
Okay.
It is inherent to medicine. Because everybody's body is different. So you react to drugs differently, you react to pain differently. Some people have got very low threshold of pain. Some people have got extremely high threshold of pain. Sometimes you sell the pain so much that they are actually in a lot of pain, but they are not complaining because you already told them they're going to get a lot of pain. And some people, if you don't tell them, it's like, I'll be very simple, pap smear. A lot of women don't want to undergo pap smear because some friend of theirs had a horrendous experience with pap smear. Oh my God, pap smear? No. It's going to pain a lot. You tell them no. It is not. There will be discomfort. So if you explain and counsel to them that it is, there is going to be some amount of discomfort because we cannot use jelly, we cannot use anything because it will meddle with the report. They are understanding. Same thing with mammography. Most of the women think mammography is like chest X-ray. You stand and no, it's not like that. You have to explain to them that your breast will come in between a film and a thing. So there'll be a little pressure. They understand. Then they tolerate that pressure. But if you just write mammography, they will think, oh my God, it's so painful because there was a little bit of pressure, which is tremendous pain for someone who's not counseled. So this is why I say you have to be transparent with your patients. And I always, we already touched upon that. And you must tell them what you know at that point of time. That, okay, if we do a mammo, if something comes up, we may do a sono mammo. That doesn't mean I do both. So, things like that. So you have to be very, very upfront. Yeah.
So how does observing medical errors done by your own mentors? Have you?
Yeah, as I said, we touched upon this, that if your own senior, you've seen them hiding errors, you think that is a done thing, and you will not, and that's a very bad training.
So
I'll give you a simple example. I've got tons of experience in this.
Okay.
I was a young assistant professor in Manipal, way back, I'm talking about 93, when there was a Chinese intern who wanted to very badly see me do a hysteroscopy. And I said, okay, I'll show you, don't worry. So, I put in the scope and I knew what I've done. So I said, okay, have a look. So he bent down, had a look. He said, sir, what is that thing moving inside? I said, those are intestines. You're not supposed to be saying that. I did it. But what I did was, I showed him because he was so keen to see. I said, you're not supposed to be seeing this. I called up my teacher, Professor Pratap. Professor Pratap was extremely kind. He said, don't worry, stop the procedure. Take her to the, those days we didn't, because I'm talking about early 90s. So, we didn't have that set up, So we did a laparoscopy, saw everything, no bleeding, nothing. It was a small little thing, perforation, nothing. He stopped it, finished. But if I had kept quiet and hidden it, for that teacher, for that student, a Chinese intern from Malaysia must be, I don't remember from where he was, but he was a Chinese intern. I'll not forget that in a hurry. Because he was stunned because he was seeing something moving inside. So we have done it. We have made mistakes, but we have learned from it. So next time you have to be more careful. So you should not hide mistakes. All of us have done mistakes. Own up. Things can be tackled because we have our teachers. Just like even now in our hospital, when people are operating, I always tell them, see, none of us are Victor Bonney. Sir Victor Bonney, none of us are Victor Bonney. So don't create such a chaos that even we cannot help you. If you're in trouble, call us so that we'll help you right in the beginning. You know what I mean?
Right.
Yeah.
So do mentors unintentionally create followers rather than leaders? Do you feel? If you are...
Well, do mentors unintentionally create followers? Yeah, sometimes we do. And I think I touched upon that. We do create followers, but then provided we actually behave as true leaders, and that should, then we are worth following. As I said, my way or the highway, or my way is the only way. This is not the kind of followers we would want. And I think it's very important is we keep discussing with each other when we have a case. Okay, how you want to sort this out? What is your plan? Why did you choose this when they answer? What are the options you can think of? So these are, so there has to be an agreement and a disagreement, but in a very healthy atmosphere, so that gives the student or the so-called follower, as you said, the opportunity to introspect and then find, okay, but now, those kind of things are gone because immediately now they can just, again, Google and find out AI. It's so, nowadays things are tough, actually.
So,
compared to when we were students.
Sometimes I feel when your junior is working, I think we should give that junior person go, yes, it is, the case is for you, you do, I am standing there. I am there if anything bad happens. Then only I think they will get the confidence.
No, it's very important that if you are, it's again confidence. If that junior or this assistant of yours who's been let's say junior resident has assisted enough, then when that person is doing a hysterectomy or a C-section, don't hover around because they feel so stressed because you're watching. Be in the side room.
But you have to just
give them that
at
space.
The background that if anything happens, I am there, aap karo.
That space should be given to them. That freedom. Otherwise, it's like the trust. As I said, you can't take away, once you lose trust, even as a teacher, as a practitioner, what we have is credibility and trust. These are two very important words. If you have them, you are there. If you don't have them, you're gone.
Yes, absolutely. So one quality which you will admire in young doctors.
Oh, I mean, I think they are incredibly smart, but patience is less.
Patience is less than nilli gawa.
I'm being diplomatic here.
So one habit that every doctor should have, or if they don't have, they should develop. I think आपने बताया पहले कि we are poor
active
listeners.
listening. I always say that, we have to be good listeners because patience, I'm telling you, those days were used to be there. कि हम वो डॉक्टर को देखा हमारा तो आधा बीमारी चला गया. It was also because, of whatever. I mean, those days are gone where we just feel the pulse or we see, and we know. because we are so dependent on gadgets, so dependent on investigation. I think active listening is something which we have to inculcate amongst, amongst our things. That's important.
So a leadership trait that defines success in medicine.
See, I always say this, and this is something I'm glad you asked me this, because I say that to all my, people who want to become doctors or who are already working. There is no, you don't have to be a brilliant student to be a doctor. But I think consistent hard work is what is required. You need consistency and you need hard work. Focused hard work. And you can manage. Because I think we have very few students. There were a few in our class who used to just read once and know exactly what's happening. But they are very far and few. Because if you're not consistently doing hard work and really attending classes and really, doing your kind of whatever jobs you're being, given, it's extremely difficult.
So do you feel if there is any personal grief, loss, or some adverse transformation or some adverse, if I have experienced, I will be more, understanding towards the patient. Is it so?
Absolutely. I've got personal experience. So I have had a surgery which went all wrong. I almost went up to meet my parents way back in 2009. So came back.
So what was the
thankfully.
surgery? What was the surgery?
It was a gallbladder surgery, laparoscopic cholecystectomy.
Simple gallbladder surgery.
Yeah, that's what I'm telling you. So nothing is simple, and it happened. Yeah, I mean, it's a long story, which is that will be another unseen curriculum.
Podcast.
Yeah, but what I'm trying to tell you is that because I was in the ICU, because I know what pain is all about. I know what's ICU psychosis. So I am extremely careful about taking care of patients' pain post-surgery. I'm hyper about it. And I'm hyper about, dealing with patients' relatives, because I know what my family went through, what my friends went through. And I think whatever you're seeing me today talking to in, front is only because of the prayers of my family, prayers of my friends and colleagues in OBGYN and others, my patients who prayed for me, and people who know me prayed for me. So I'm indebted to all of them. And I feel if you do good in the world, the dividends that you accumulate, these are the dividends which help you to stay alive and continue. So I'm absolutely this personal experience, so I know how it is. So we are I'm very, indebted. So I'm very careful that personal grief, personal experience, when you go through things personally as a patient, you will respect your patient far, far, far more.
So I will also share with you, what happened when I got married and I joined MD, और ओपीडी में पेशेंट आते थे ऐसे ऐसे गिरे हुए, पूछो नहीं, पता नहीं कैसे कैसे, इतनी उल्टियां हो रही हैं, इतना, मुझे ऐसे लगता था कि यार क्या है, इतने कितने नखरे कर रहे हैं. मतलब I had a very bad, मतलब to tell you the truth, now I feel very bad about it. I had a very, मतलब bad type of feeling with those patients ना, कि मुझे लगता था कि सब all are functional. And then I became pregnant and I had such severe nausea, vomiting. I lost 6 kg of weight. And then every time कोई भी उसके बाद आता, so my attitude was different, totally.
This happens. The personal experience, nothing, and that is what I said, this is unseen curriculum, because this is not there in the textbook. We know hyperemesis gravidum mein kya hoga. We know what is there. But if you face it yourself,
then you know the gravity.
Then you become empathetic, and not only empathetic, you become sympathetic to the patient. As doctors, we never want to sympathize. We want to empathize. Because if you internalize, then there's a problem. Because you cannot be internalizing with everybody.
Yes.
You understand what I'm doing? Then you'll have heart, you'll have high blood pressure, and you'll end up with, a cardiac arrest. But what I'm trying to tell you is that this is what, see, you've had a personal experience. I've had personal experiences, so I know.
Literally. So, the toughest skill for doctors to master is what? Toughest skill.
Yeah, toughest skill, I think, is to say that I don't know this. That you actually own up and saying, okay, I'll read up. And I always say that whenever I'm taking a class, I will see you people, especially the people who are taking MD and MS now, of course it's MS now. Their theory knowledge is so much. You actually cannot match their theory knowledge because they have read the recent stuff, everything. But it is also important for you to say, okay, where we are different is we beat them with our clinical knowledge. We beat them with our experience.
Yes.
But I don't know these three letters, words, difficult for a doctor to openly admit.
Yes, absolutely. So, what is your quick stress buster?
My stress buster is piano, playing the piano.
Okay. So you play
I
it very
enjoy.
frequently?
Now a little more because I've got more time to myself with all my Rotary commitments off. But like I have a piano in my clinic. I mean, I'll be very honest with you. I'm a little passionate about playing the piano. So that really calms me. And why I'll tell you, because, when you're in the clinic and you finish your clinic, your room is cold, nice and AC. Your patients have left. High chance that they're not going to bug you. So you just play for half an hour to yourself. But what happens is you leave your clinic, you come home, you chill your room, you sit on the piano, and then one call will come. Doctor, gone. So you know what I mean? So I've analyzed these things after a lot of, many years, and I've thought, why do I have a clinic in my piano? It's because initially, suddenly last minute patients won't come. And you don't know, because I call one patient every half an hour, always, right from day one. I suddenly had nothing to do for half an hour. I used to get irritated. So I said, okay, why should I get irritated? Piano behind me, just turn around, start playing.
Great. So, any book that influenced your life or your thought process or something?
How to Win Friends and Influence People. I think that's one of the best books, which if you read, I think gives you a lot of insights. Yeah.
Of course. So a medical myth you wish should disappear forever.
Yeah, you see, when we were registrars or we were senior registrars especially, we always wanted to do Caesars very fast. 20 minute, 25 minute mein, some people want to do it in 15 minutes, skin to skin. I feel as we, and now some of my friends ask me, are you doing RBC catching? It is like, you understand that over the years, speed is not something which is that important. It is important that your patient, and I always tell my residents, whenever they join, a new registrar joins, I tell them, see, whether you like it or not, no abdomen should be opened because of lack of hemostasis. Reopened. 1. 2. Please give uterine angles separately when you're closing the uterus, and give rectus angles separately to avoid Spigelian hernia. Fast, we don't want to. So these are few things I say. Don't try to save 5 minutes because later on you're going to take away many days of that patient when it comes with a rectus sheath hematoma or because most of them will do such fast Caesars, those lateral bleeders and all that, they will quickly fast. Vulval hematoma, quick episiotomies, fast, and then huge vulval hematoma. So we want to avoid. So now but now I'll tell you, the present, the generation, because of this medical legal jhamela problems, I think they've also become a little careful. They also don't want to get into too much of unnecessary problems. So I think it's coming. So it's in a way good.
So what keeps you motivated to work so much in the field after decades? Like you are doing Rotary, you are doing this medical.
You see, the game changer for me, frankly, I'm not a gynec oncologist, was prevention of cervical cancer with the HPV vaccine. This is something which I have been, at it since 2009. I vaccinated my daughter in 2008 when it was launched in October. It was launched November. I had given her the vaccination. And I don't know if you recall, when we were postgraduates, when we were students, there used to be one yellow colored book on contraception by Professor S.K. Chaudhary. And the vaccine which we thought we will get is the LHRH vaccine for fertility. But wo vaccine to nahi aaya, thanks to Professor Gerald Zurhausen from Germany, who got the Nobel Prize for physiology or medicine way back in 1995, I think, we got the HPV vaccine. So this is something which has changed the entire thing. And for me, if I can save a girl from sheer death by giving a vaccination, and I think that has been, there are a lot of people in our country who've been doing fantastic work. We have Professor Neerja Bhatla, who recently got the Padma Shri. I am a great admirer of her. She's a dear friend. And I always say, Professor Shankar Narayan, I'll never forget, Ranjit Mondol here in Calcutta. We've been really at it, and we've been doing our little small way. We have AOGIN taking it up in a very way, Fogsi taking it up in a big way, AOFOG, FIGO, WHO.
Now IMA has also taken it.
That's what I'm saying. So everybody is into it. And this has been something, it's like it's passion for me. Like piano, preventing a girl from, getting cervical cancer is a passion for me. And through Rotary, we have done thousands and thousands of pre-vaccinations. We right now have 2 global grants where we are going to vaccinate the 2-dose. Although the single dose is, already there, but unfortunately 2-dose is still, it's the 2-dose which is officially accepted by the Drug Control Journal of India. So till the single dose comes in a major way, we cannot. So we are doing it, and we're going to vaccinate another 2,500 girls. So we've crossed 10,000 girls, the way we have done it. So we are really, I'm very passionate about it. And I think that's what keeps me going. And I like to be busy.
So if you were not a doctor, what profession you would have chosen?
100% pilot. I love aircrafts. I wanted to be a pilot. Oh, yes, I want to be a pilot from when I was, in class 1 or 2. But because, those days we got specs when we were class 3 or 4. And we had no corrective. We couldn't do any corrective surgeries those days. Way back in
these
70s.
Days, so we have.
60s, late 60s and early 70s. So I had no chance. But that's a passion which I always want to do. I always want to be a pilot, airline pilot.
So is there anything in this hidden curriculum which every mentor should consciously teach to their students? Like maybe this listening habit, or maybe being honest.
See, honestly is that I personally feel you have to be honest and truthful and live your life in a very credible way. You must be able to walk with your head held high. You should know that you should not be cowed down by some people should not have any things to point out at you which should put you down. And that is where you will actually have people walk along with you, the so-called followers, if you wish. But followers should be with you, because you just can't have people behind you. They must be with you. So if you are always true to the people whom you deal with, be nice, be humble. This humility, you've been working, speaking on that word, which is very important. If you're humble, you're truthful, and you must not only be seen to be truthful, but you should be truthful. It both ways, truthful and seen to be truthful.
So do you think that technology which is coming these days, is it a boon or is it a distraction for our young doctors, that they don't experience those things which we have experienced? Like
it is
they are
definitely
too much dependent on, on the machine, too much dependent on technology these days.
No, it is definitely a boon. No, it is definitely a boon. Because it saves a lot of time. I think, I remember, again, I'll go back to my Manipal days when I joined as a young assistant professor. We learned our typing. We didn't know how to type. Maybe because I could play the piano, I could type easily, but I never learned how to type. But we typed on WordStar. I don't know whether you remember, there was a software called as WordStar. We learned all our typing on WordStar and things like that. So that was technology. Everybody thought, the computer will replace X, Y, Z. But it is been a boon. So, but a boon, whatever, technology with discipline is very important. Same thing with AI. We all are scared of AI. But ultimately, who created AI? It's this, no? A human brain has only created AI. So we must also know how to control AI. So we should not be scared of AI. Because if you don't embrace AI, AI will replace you. So you have to embrace it with discipline and with humility. Learn what is good, and I'm sure it's a huge, like, again, I'll give, I don't know whether we are running out of time, But I remember when we were getting our thesis typed in Manipal, the first
Yeah.
ever electronic typewriter came way back in
Sure.
1989. Yeah.
Yeah.
So 90 was, when I gave my MD. So we had to finish our thesis by 89 end, no? So to get all of us wanted our thesis to be typed in that electronic typewriter.
Ours was different typer. It was 2
You
years
see, now we
before.
laugh. Now our phone can type. We have iPad. I mean, like even when we were in school, I remember when we saw the movie Star Trek. When Captain used to speak in front of the phone, the face used to come. We used to say, what rubbish is all this? But Steve Jobs made it happen with FaceTime. You just go back. So what AI will do, what it can do, we don't know. But ultimately, we are the ones who are going to make it happen. So we should not get scared of technology.
So how do you handle pressure when you think that a patient's life totally depends upon you? So is there some mantra, some part, some kuch
Yeah,
karte
I
hu,
mean,
main to
I
Bhagwan
personally
ko
feel,
yaad karti hu.
yeah. See, I may not, I'm not one of those devout prayers who'll go and break a coconut in the temple and all that. But we do, our prayers. We always, try to take a deep breath and, just calm, because you need to calm yourself down.
Calm yourself.
And because
It is more
as it is,
important.
we are under tremendous stress. So I think,
I think if you keep yourself calm, then
And call
only
for
you
help.
can take right decisions.
And call for help. You must have people rallying
Yes.
behind you to help. Never think that you are the only one and you're the only one who can do it and all that. And
So
then
do you
move along
believe
and take the right step.
doctor must develop a fourth dimension to handle emotional stress, like you have piano?
Yeah.
Everybody should have
Of course. You must have. Someone, we must have another passion. It could be painting, it could be cooking, it could be music, it could be singing, it could be drawing, it could be whatever. But whatever you do it with compassion, do it with love, and really feel happy doing it. Like I have a professor in my unit who loves operating. I think, his passion is to operate.
Okay.
You give him any number of, and I'm very thrilled about it because I have to operate less because of that. So he loves it. So, I'm blessed. Some people have said, so he's very happy. So, okay, chalo, karte raho. And he is very happy. So I am very happy doing my thing. You're very happy doing, I'm sure you have something, but whatever it is, you must be liking what you're doing so that you can have a, space to breathe and, reflect and revamp yourself and rejuvenate yourself. I think that's very important.
So I think we are almost finished. So one thing I would like to know that what do you think is one thing which next generation should remember about you?
Someone
of your students.
I think someone who always meant well for the students and always wanted to do good for them. I've always, always tried to help. I've always used my power to help people. When I was in Manipal, when I'm in here, I held pretty important positions while I was in Manipal, over and above being a teacher in the university. Even when I'm here in Calcutta as a Rotarian, and in whatever positions I hold, thanks to all of you here, like in AOFOG, now in FIGO, it's always to do good for others, to do good for the generation. In whatever little way I can help juniors to come up, to rise, I'm always there.
So, any mentor which you remember that has changed your life forever?
Well, it may sound cliched, but I had a very strict father. And very strict. He was a no-nonsense. I'll not call him a military man, but he was a very practical man. And I was always very scared of him. I always thought, that's not the way to bring up a child or something like that. I was sent off from Calcutta to a hostel when I was 10 years old. I was in Ajmer, Mayo College, when I was studying here, because he saw that there was these, political issues, the Naxal movement that time. He said, no, better to send him out to study. And I was just a small So I had to read Hindi in class 5. I'd never learned Hindi. So from class 1 to 4, I'd learned Bengali. So 1 to 5 ka Hindi I had to finish in 1 year and take the Mayo College exam. And I went, I was crying. But the way he has educated me, the way he has mentored me, although I didn't like it initially, but now I feel, oh my God, but for him, I don't think I would have reached anywhere, because he taught me the practicalities of life. I mean, otherwise I may have been an absolute spoiled brat sitting in Calcutta, during my school days, because I was in the hostel. I've been out of Calcutta for 25 years. I've been out. So when I came back in '97, I really enjoy Calcutta, and it's Kolkata now. The way I'm enjoying myself in this wonderful podcast webinar that we are doing, Poonam. I'm really thankful to you for that, and to Sunita,
yes,
and to Fogsi.
So, any message you want to give to our viewers? The younger generation, I would say, more to the younger generation.
Well, I think, again, these, the words which we discussed, be truthful, be humble, and try to help someone, because you have the opportunity to help. You should never feel I've done enough. There are always that bit more that you can do to help someone. Whoever it could be. It could be just educate a child, pay for a vaccine, 2 doses for the cervical cancer vaccine. It makes you feel so good when you give. There's no substitute, for that. The happiness that you get when you help someone.
Absolutely. So I think we can end here.
Thank you so much.
Thank you so much.
And I should give you really many thanks for
our guest today. Thank you so much.
I've been as frank as I could. Yeah.
Yes, of course. I think
I hope
you are always like
curriculum.
that, Anna. You are always
Yes.
like that.
That's true. There's no acting involved.
Yes, of course.
Thank you.
Thank you so much. So see you
Thanks
all
to the team
tomorrow.
also. Thanks to the team, the support team of Gyan Pravah.
Yes.
Yeah.
So see you all tomorrow at 8 p.m. Gyan Pravah next episode. So taking your leave, Dr. Poonam Goyal, Dr. Krishnendu Gupta. Thank you so much.
Thank you. God bless you. Bye. Merry
Thank
Christmas.
you.
Happy New Year.
Thank you, sir.